Senator Markey.
Thank you, Mr. Chairman, very much, and thank you for taking a serious look at how to support employee ownership. In Massachusetts, we have over 100 companies that fall into this category, with nearly 24,000 employees who are owners. It's an excellent way to empower workers to set their own.
Senator Markey, I'm sorry. Senator Banks was here before you, and we should be going back and forth. Can I ask, would you mind if we go to Banks and then you?
If everyone would remember where I was in my remarks, I would appreciate it. Yes, yeah, no problems.
That is my bad. I was
No
looking
problem.
over here, not over there. I'm sorry, Jim.
My colleague, but I'll be quick. And Mr. Chairman, I appreciate this hearing very much because my mom, for over 30 years, worked in nursing homes, and as a cook, she was a cook in a nursing home, and the nursing home that over time became an employee-owned business, became an ESOP. So my family saw firsthand the value of ESOPs, and I'm glad to see the bipartisan support coming out of this committee to do more to support employee-owned businesses, because I've seen firsthand what that can do for families like mine and families in my district. And Mr. Blasey, there are about 6,400 employee-owned companies in the state of Indiana that represent over 15 million workers and retirees like my mom. Urschel Laboratories in Chesterton, Von Tobel and Lafayette, Michigan City and Valparaiso, Corellis Roofing in Hammond, and BSA Life Structures in Indianapolis, just to name a few of the ESOPs that have a great reputation and do great work in our state. 15 million people is a lot of people, but it covers just a very small percentage of the entire workforce of the state of Indiana. And I wonder if you could explain how would the economy overall be different if there were more workers who worked for ESOPs?
Our research suggests that one would see fewer layoffs, more employment stability, so fewer unemployment compensation costs in the economy. When a community, and we're talking about mostly, forget about really huge cities, 33,000 counties in the United States, many small towns and some very small cities, a few companies that can be sold to an ESOP from a retiree business owner ensure a lot of social stability in those communities. When families lose their jobs, there's increases in alcoholism, there's increases in divorce, there's all kinds of effects on children and families. We have to look to the human impact. When a small city of 10,000 people loses the supermarket, or its anchor manufacturing because it's sold to some country outside the United States, that's really not a good thing. So ESOPs really go directly at this issue in a very significant way.
Indiana is also the top manufacturing state per capita in the country. And you've already talked about the manufacturing industries being ripe for employee-owned businesses, but how can we motivate that? How can we speed that up to restore the manufacturing base in this country that makes America great?
We can speed that up because many retiring business owners who have manufacturing companies, they could get a 100% check from a private equity firm or a strategic buyer, but ESOPs need more loans and loan guarantees to be able to finance 100%, although I defer to Mr. Chairman saying that it doesn't always have to be 100% ESOP.
Good. Well, like I said, this is such an important topic and conversation. I hope to work with you, Mr. Chairman, and others on the other side of the aisle to support employee-owned businesses like the ones that I mentioned. It makes a difference in Indiana. Thank you. I yield back.
And Senator Markey, thank you, and take an extra bit of time if you need to.
Thank you, Mr. Chairman, very much. And I'm the ranking member of the Small Business Committee, and I know how crucial it is at this point to expand employee stock ownership plans. In Massachusetts, much like elsewhere in the country, over 50% of businesses have an owner that is 55 years old or older, and many are struggling to find a succession plan that honors their life's work. Too many have to close their doors or turn to a corporate buyer that has no loyalty to the business owner. the workers or the community. And I look forward to making progress on this crucial issue. Mr. Dupuy, you have stated that Arcadian was founded in a medical transport crisis. I would imagine that having ambulance crews as owners means they know how important emergency medical services are. When a loved one has a heart attack or a stroke, you're the ones who will get them to the hospital in time. They're also understanding of the financial difficulty for the business and patients when people don't have insurance, or how difficult it can be to provide emergency care in rural areas when the care that people need is just too far away. What is the impact of having frontline emergency providers also serve as owners of the company?
Thank you, Senator. Yes, our employees are very aware of, obviously, the personal situation of patients as they're going through a crisis. And from a managed perspective, we're aware of the reimbursement reality of what a patient may or may not have. Ultimately, though, our mission is to provide the best medical services we can. And we are out there, I think it's sort of a blind issue, if you will, in that we allow them to worry about providing the care, and we manage the financial aspects of it.
Yeah, and again, we're not any longer in a business as usual environment. We just had the biggest cuts to medical care passed to Congress and signed by the president in the history of our country. I wish that we had this hearing before we had votes on that bill, especially for someone like you, in terms of what the resources are that you need. The $1 trillion in cuts will push 15 million people off their insurance and make it more likely that rural hospitals will close their doors or cut services like labor and delivery, mental health, pediatrics, or emergency care. And those cuts are absolutely going to impact businesses all across the country. So would you like to expand further, Mr. Dupuy, in terms of what the impact?
Yes, I can. I think that certainly we are a healthcare provider, so the Medicaid cuts will affect us. We understand what Congress was trying to accomplish. We respect that. We hope to have additional conversations. However, I think the thing for our business is that, when people come off the Medicaid rolls, that doesn't stop us from having to provide a service. So we have to answer the call regardless of a patient's ability to pay. And so it simply means that we will still have the same level of cost and operating expense, et cetera, but our reimbursement may either be zero or reduced as a result for a portion of our patients, obviously. So yes, it is a concern, and similar, if you don't mind, I'd like to supplement, because it goes hand in hand with what Senator Cassidy asked earlier about how do you address a downturn in your business or other issues. I think that being an ESOP instills a certain level of discipline in the management of the company. We are dealing ultimately with our employees' retirement accounts, and we see them every day out in the field, and we have to make very prudent and real, sometimes difficult decisions to be able to protect those retirement accounts. And
We know that, and we absolutely know that, but we just can't cross our fingers and hope. A vision without funding is an hallucination. You have to have the funding in order to accomplish the goals that you are talking about, and we know people are going to be hurt unless those cuts are reversed. And employee ownership gives workers dignity. It gives them security. It evens the scale between workers and big corporations. But I just think that we just can't see a reduction in people's lives, in their dignity, in their security, because that is going to absolutely require us to reverse the balance that's now been struck for the future, which is that billionaires get bigger tax breaks and individual workers' programs that are central to their well-being, keeping their companies going and the services they provide, receiving the funding which they need. So that would be my perspective on this, and again, I think it's central to making sure ESOPs get the resources they need to be successful. Thank you, Mr. Chairman.
Senator Kane has a follow-up.